are going to discuss very important topic of child health nursing, that is pediatric history taking. And what we consider in this, first one is patient's profile, presenting complaints, history of present illness, birth history, feeding history, immunization, developmental history. And another one, past history, personal history, drug history, family history, and socioeconomic history. What we ask from the family about the patient's profile. First one is name of the child, age, particularly date of birth, then gender, address of the parents, and date of admission at the hospital, right? Then presenting complaints. Presenting complaint, we would like to talk with the parents about to collect this part of the history, and we have to write in a chronological order. Which symptoms appear first, we write first, then after that another symptoms or complaints. Then the next one is history of present illness. Inquire as to when patient was last entirely well, when the child feel healthy, fully feel healthy previous time, and presenting complaints. What is the time of onset of the complaint, duration, how much time it take, then frequency, course, place means site, which body site affected with this complaint, then quality, character. If for example, if pain, the pain is dull or sharp, this kind of question we have to ask to the parents. Then composition of vomitus, if vomiting is present, then it is a liquid or which kind of things present in the vomit. Then quantity, severity of the pain and amount of the vomit, for example. Then provocative factors. Provocative means which factor makes the pain worse, and elevative factors, which makes the pain moderate so that the patient can bear that pain, right? Then variation. What do you mean by variation? Diurnal or seasonal? Seasonal means in a particular time of the month or year, or diurnal, every day the symptom present. Then associated symptoms, the symptom present in the patient, the another kind of symptoms also present, that is the associated symptoms, means other sign and symptoms that occur when the problem present in the patient. Then treatment, if any kind of treatment previously taken by the child. Then after that systemic inquiry. In this, generally we have to check the weight, if weight loss or the child feel appetite. Then after that cardiovascular system, shortness of breath on exertion when the child play, then shortness of breath and sweaty on feeding, cyanotic spells. What is the cyanotic spells? It is a pediatric emergency which require immediate treatment. It occurs due to hypoxic events in a child due to decreased pulmonary blood flow and right to left shunting. Then next is squatting. It is a kind of position adopted by the child with cyanotic congenital heart disease, and this position helps to relieve exertion induced dyspnea, right? Then fainting or syncope, it is actually the temporary loss of consciousness. Then after that cyanosis, the bluish coloration, discoloration, edema, chest pain and palpitation. The next one is respiratory system, sore throat, earache, cough, wheezing. It is a kind of sound occur during the breathing, and it is a whistling sound actually. Frequent chest infections, history of respiration, hemoptysis, Hemoptysis is the coughing up of blood. When the child cough, it also the blood mixed in the cough or the material they cough out. Then the next is gastrointestinal system, abdominal pain present or not, vomiting, jaundice, diarrhea, constipation, blood in stools. Then central nervous system, fits, syncope, dizziness, headache, visual problems, numbness, unpleasant sensation, weakness, frequent falls and incontinence. Genitourinary system, stream, dysuria. Dysuria is painful or difficult in urination. Then frequency, nocturia, the frequency of urination at night, at night time. And enuresis, involuntary urination, particularly at night time. Then incontinence and hematuria when the presence of blood in the urine. Okay. Then rheumatological system, limp actually when the child walk, he or she feel difficult in walking. Okay. Joint swelling, hair loss, skin rash, dry mouth and mouth ulcer, dry or sore eyes, cold extremities. After that, the birth history. It is very important for the neonate. In this, we have to ask about the antenatal history of the pregnancy, H and N status. H means health and N means nutritional status of the mom during pregnancy. Then illness during pregnancy, if any kind, hypertension, diabetic mellitus, preeclampsia, antepartum hemorrhage, infections during pregnancy, rubella, urinary tract infections, syphilis and TB. Drugs, the drugs taken by the mother during the pregnancy, iron, multivitamin, other drugs with dose, duration and at which time of gestation. Right. X-ray, history of radiation in first trimester. Then TT, maternal vaccination against tetanus. Then past obstetric, problems with previous pregnancies, any kind of stillbirths, miscarriages, birth weight of previous children, then prematurity, blood transfusion, if any kind. Then natal history at the time of delivery, place of delivery conducted in the hospital or at home, conducted by the trained health visitor or doctor, sterilization techniques of instruments and gestational time, length of the time, rupture time of rupture of membranes, then labor time, duration of the labor, presentation and type of delivery, then sedation, analgesics during labor and any kind of complications if present. Then postnatal history, first cry by the child, immediately child cry or cyanosed or apneic, then basic problems, need for resuscitation during the delivery, then problem with respiration, sucking, swallowing, birth weight, any kind of birth injury, convulsions, cyanosis, jaundice, fever and any kind of rash if present at the time of delivery. Procedures, exchange blood transfusion, umbilical, artery catheterization and any kind of drug. After that, feeding history, significant in child less than 2 years, anemic or malnourished, onset of feeding, after how many hours of the delivery start the feeding, type of feeding, breastfeeding and the duration of that, bottle feeding if present, then at what age they start the bottle feeding, composition of formula which given to the child, amount of feeding, then frequency, dilution, then supplements, any kind of vitamins, iron, weaning, if started, when started, what they give to the child, amount of and frequency, then current diet, any change in diet during illness. Then the next one is immunization. Check the immunization card if present with the parents. Then types of vaccinations given to the child, age at which started and by whom started, doses and any kind of adverse effects. After that, the developmental history, achieving age of various milestones, when the child starts smiling, hold the neck, sit, crawl, stand, walk, talk, and control of bladder and bowel compared with normal for this age. What kind of things we have learned in growth and development, we have to compare the developmental history with that. Then we detect it is the normal development of the child or not, right? Then next one is past history, significant illness in the past, diarrhea, respiratory infections, fevers, fits, jaundice, history of similar complaints in the past. Then the personal history, particular habits of child, details of class, schools and interest in studies, any missed school attendance, then behavior of the child at a school and a relationship with other children. After that, the drug history, any medications used, the frequency of that drug, dose, adverse effects, allergy to any drug, history of mom drug, if mom used that drug in the neonate or breastfeeding time. After that, the family history, it is also important to know about the chromosomal, hereditary or infectious disease. Then age of the mother and father, how long they married, consanguinity. It is actually close relationship. In some religion, the marriage done within the cousins, okay, in blood relation, that is the consanguinity. Parents' health, present and past, siblings, numbers of the siblings, age and gender, illness, any death, then stillbirths, miscarriages, grandparents' health, if they're living with the family, health of uncles, aunts and their family. And here on the 7th point, you have to make the family tree. After that, socioeconomic history, parents, education and occupation, family income, house made of, personal living size. Actually, in socioeconomic history, you already visit the community and there you have filled the folder. That history also mentioned here. Then cleanliness and general hygienic conditions, source of drinking water and any pets at home. This is all about the history taking in pediatric and it is very important. Thank you very much. I hope you have clear with this. If you feel any kind of dikkat, kindly inform me. I'll surely help you. Thank you.